Okay, in this video we're going to be going over a single leg stability exercise. So you'll be maybe thinking that this looks familiar to doing a single leg RDL. The only difference is that one leg is actually going to be supported against the wall, getting a little counter pressure, as well as it's kind of like a 2-in-1 exercise. We're going to do a clamshell-like movement on the floating leg, which we can add a TheraBand around the lower leg just to make it more difficult over time. But let's start without a band, right? Let's get the form down first. So let's talk about setup. So just pretend like this is a wall. Just make sure whatever you're putting your foot against is a secure surface and it's not going to move on you. So you want to be far enough away from the wall to where when your foot is up against it and you go to sit back in your RDL that your knees are in line with each other. Right now my forward leg is further forward than my back leg, so I know I'm too far away, so I'll scoot back about half a foot, and then this looks better. Actually might scoot back a little bit more. So once you're in position there, you instantly want to sit into your hips. Slight bend in the knee happens, but most of the movement comes from the hips, and you should instantly feel all these tissues start to tense up and fire up to keep you stable on this leg. So once you're here, light pressure down through the big toe, and then as far as the leg that's on the wall, you're going to pivot from the ball of the foot. So if you run out of room here, that's just the end of the movement. You don't need to roll onto the outside of your foot. So again, light pressure in this foot that's hitting or touching the wall, and then clamshell movement there. The more that you push this leg out, the more tension builds up here. You're shifting your body weight and you're trying to counterbalance here. So imagine if you add a TheraBand there, it's going to try to bring this knee in and you're going to try to resist it out. This guy's going to be working against the band. Like I said, it's a 2-in-1 exercise for sure. Woo, you have quite a burn. So give that a shot. It's definitely a great stability exercise.